After your operation, you may require radiation therapy and possibly chemotherapy. This will depend on the type and extent of the tumor.
Dr. Van Zyl told me that they will use extreme radiation.
Radiation and therapy and chemotherapy are both types of cancer treatment, and they both work on exactly the same principle but delivered in different ways. What we do is we damage the cell molecules using the radiation beams and using free radicals. Now, chemotherapy also will damage the molecular working of the DNA of the cells in various different ways, various different mechanisms. And what this does is it jams up the multiplication process of all cells that are dividing. Now, normal cells can detect and repair that damage. Cancer cells cannot. So in effect, we're doing the same thing with chemotherapy as with radiotherapy. The key difference comes in what we're actually treating. With radiation, we're treating a target. In other words, we're treating something that we can visualize virtually in 3 dimensions. And it's a small area. Whereas chemotherapy goes into the bloodstream and it can go anywhere that there might be any cancer seedlings going. So we use that to treat what we call systemic disease or disease in the whole body. And sometimes we combine them, and particularly in head and neck therapy, we combine small doses of chemotherapy with radiation, and what that does is it makes the radiation more effective. When it makes the radiation more effective, it means that the cancer treatment is better, but it also means that the side effects on the normal tissue are worse. However, the repair process is the same in both, whether we use the chemotherapy or not.
It can take some time for the body to recover from the effects of radiation.
There are 2 phases to radiation injury. There's what we call the acute phase, which lasts until up to 6 months by definition, and then there's the chronic or long-term effects of radiation. Now, the effects of radiation will depend on the amount of dose, in other words, how much radiation an area receives, and at what rate it received that radiation. It also will depend on how sensitive the normal structures in that area inherently are to radiation. So the first thing we tell patients is that, like with any surgery, any operation, that there will be long-term effects after radiation. There will be scarring.
So that take about 3 years altogether to wear off.
That we try and modify by using very fancy techniques, and particularly in head and neck cancers where we tend to have to use quite high doses to get tumor control. We are very careful about where our doses go and onto what structures the doses go.
The actual mask that they make for you is a very tight-fitting mask with holes in it. It's a sort of lattice work that they have over your head and clips tight. Easily could make you feel terribly claustrophobic because your whole head and your face and your mouth and everything is all tied up in this lattice work of things. Not a very pleasant thing, a prospect, and a lot of people found it, the claustrophobia, just unbelievably unacceptable. It really didn't worry me because I understood what they were trying to do, and I knew that what was coming on here would come off at the end of the session, so it wasn't the end of the world.
I think 3 weeks ago I actually threw the mask away. I was told to keep it for 3 years, and I found it when I was clearing up and I threw it away, and I felt so good about it.
One of the serious side effects and main complaints from patients is to do with the effects of radiation on the salivary glands.
It depends on what volume of the salivary gland gets treated. In other words, how much of the salivary gland we're actually treating. If we treat a whole salivary gland to a high dose, it's going to turn off and not turn on again. But if we treat a portion of the salivary gland to a low dose, there'll be a temporary loss of saliva, and then usually within 3 to 4 months after the radiation is completed, the saliva will be back, and in some cases, in fact, it tends to go the other way for a while, and they tend to get too much saliva at times, and then that usually settles down as part of the long-term effects, either with a dry mouth after the 6 months and reaching a maximum at about 2 years. Otherwise, patients will return to normal and they will not notice any difference.
One of the most important and difficult things to manage in the recovery process is ensuring you are getting enough nutrients.
And the nutritional part is very important because it really does. I found that my patients who have lost less than 5% of their body weight during their treatment are back up to speed within 6 weeks of their radiation, whereas patients who lose more than 10% of their body weight can take up to 6 months or longer to recover, and some don't ever recover. And so, particularly when you start losing lean body mass, your general condition will deteriorate quite quickly.
There are dietitians on hand to help you formulate a diet plan that works for you. Most people find that they can only cope with meal replacements.
With your meal replacements, they are essential to the recovery process because, I mean, most of the vitamins or the fruit and vegetables that we eat nowadays do not have enough vitamins and minerals in them. So you can blend, you can puree, you can strain, you can do all the correct things, but your micronutrient status is still not going to be adequate. So with the supplements, they do have 100% of the RDA in sort of the recommended dosage. So they form a vital part of any meal plan. They've got fiber in them, which helps with the constipation, which is often, a frequent problem in these patients. We get some very high energy, high calorie ones, which prevents the weight loss because, a fluid diet, it's very difficult to meet the patient's requirements. So with the use of these, it helps us to reach them sort of more adequately and without increasing the volume that the patient has to drink.
The effects of radiation and chemotherapy can be profound. Family and friends can help support you through this period. Remember, it is temporary, and that the better your nutritional intake now, the faster you will recover. For some patients, a feeding tube called a PEG is often placed directly into the stomach to assist with adequate nutrition and to help reduce the need for oral feeding and all the associated discomforts. For some patients, a feeding tube called a PEG is often placed directly into the stomach to assist with adequate nutrition and to help reduce the need for oral feeding and the associated discomforts.
The family, it's quite difficult because I think if you have not gone through cancer yourself, the patients find it very difficult to try and explain to the family how they're feeling. And that sort of loss of appetite is severe. They really have no desire to eat. So what the family needs to do is just make meals as appetizing as possible, make them pretty to look at, use lots of different colors. Try not to cook food in front of the patient. So the patient must sit in another room, open all the windows so that they don't get those cooking smells, because that can often, sort of stimulate the nausea and then the vomiting, and then you don't want to be eating. So lots of different color, make meals appetizing, eat in a calm, relaxed atmosphere, friends, family, and obviously just try to be as supportive and understanding as possible because they really sort of think that you don't understand.
I think the third week of my radiation, when I just wanted to be everything had to be quiet and still, and I just wanted to have my head, the blanket covered over my head, because I didn't want to eat, drink, I just wanted to be left alone. My husband wasn't serious at all in that time. He would try and make me laugh, and the kids were up and down like nothing was happening, and that was fine with me. They just knew Mum is not feeling well, just leave her, to be by herself. And he used to encourage me to drink the ensure, and that was torture. But I knew I have to, even if it was just a glass a day. First two weeks I was fine, and I thought, I'm going to have a smooth journey here. And then we were having cake and tea, and I tasted a bit of the cream, and there was a terrible, terrible taste in my mouth. And that was the first sign. They warned me about that. My taste would change.
For changes in taste, there are a variety of meal replacements designed to compensate for these variations.
The taste changes again have got that omega-3 in them, and I'm not actually sure, but they take away that metallic taste, because a lot of the time you get a metallic taste in your mouth from the chemo and radiation, and they actually take it away. And then there's also like yogurt style drinks, which seem to the patients enjoy a lot more. And there's like clear fluids, which for us sort of non-cancer patients have got a very metallic taste, but the patients actually really enjoy it. So there's huge range, huge variety, lots of different flavors, because you also want to prevent taste fatigue, because when you're drinking the same thing every day, you're going to get tired of it.
Taste is one of the things that gets affected very early. It gets affected within usually 10 days to 2 weeks of the radiation starting, and it tends to disappear after about 3 or 4 weeks of radiation if we're irradiating the oral cavity. If we're not irradiating the mouth, the taste will stay intact.
It is possible that your sense of taste will disappear completely.
If you can't taste anything, I mean, obviously we just try to say use lots of spices, lots of herbs, try to flavor the food as much as you can, and that should help a little bit. And all that you've got to remember is that it's not forever. Once the treatment is finished, a few months after that, everything does go back to normal. So your taste will come back, your smell will come back. So just try to remember that and live vicariously through your family. Ask them how it tastes, how it smells.
Taste will usually return almost completely within about 3 months, and it should be back to its best by the 6 months period that we give for acute effects returning. For every patient that you're going to have a problem with, you're going to have a patient that's had a very good response. And I've treated a patient who was a wine taster by profession, and we had to treat his oral cavity, and he's back at work. And the only thing he says has happened is that because he had to smell instead of taste for several months, his abilities have in fact improved because he can smell better.